Hello, I'm Taylor Noel, and this is a public service announcement on bacterial vaginosis. Bacterial vaginosis is a vaginal condition that can produce vaginal discharge and results from an overgrowth of certain kinds of bacteria in the vagina. In the past, the condition was called Gardnerella vaginitis, after the bacteria that were thought to cause the condition. However, the newer name, bacterial vaginosis, reflects the fact that there are a number of species of bacteria that naturally live in the vaginal area and may grow to excess. The Gardnerella organism is not the sole culprit causing the symptoms. When these multiple species of bacteria that normally reside in the vagina become unbalanced, a woman can have a vaginal discharge with a foul odor. Bacterial vaginosis is not dangerous, but it can cause disturbing symptoms. Any woman with an unusual discharge should be evaluated so that more serious infections such as chlamydia and gonorrhea can be excluded. Symptoms may also mimic those found in yeast infections of the vagina, and these conditions must also be excluded in women with vaginal symptoms. Bacterial vaginosis is a common condition. It is the most common vaginal complaint in women of childbearing age. Studies have shown that approximately 29% of women in the U.S. are affected. Bacterial vaginosis is found in about 25% of pregnant women in the U.S. and approximately 60% of women who have a sexually transmitted disease. The cause. Researchers have had difficulty determining exactly what causes bacterial vaginosis. At present, it seems to be that a combination of multiple bacteria must be present together for the problem to develop. Bacterial vaginosis typically features a reduction in the number of the normal hydrogen peroxide producing lactobacilli in the vagina. Simultaneously, there is an increase in concentration of the other types of bacteria, especially anaerobic bacteria, which is bacteria that grows in the absence of oxygen. As a result, the diagnosis and treatment are not as simple as identifying and eradicating a single type of bacteria. Why the bacteria combine to cause the infection is unknown. Certain factors have been identified that increase the chances of developing bacterial vaginosis. Some of these factors are multiple or new sexual partners, intrauterine devices for birth control, recent antibiotic use, vaginal douching, and cigarette smoking. However, the role of sexual activity in development of the condition is not fully understood, and although most experts believe that bacterial vaginosis does not occur in women who have not had sexual intercourse, others feel that the condition can still develop in women who have not had sexual intercourse. Transmission. Although bacterial vaginosis is not considered to be a contagious condition, the role of transmissibility of bacteria among individuals is not fully understood. Since having multiple or new sexual partners increases a woman's risk of developing bacterial vaginosis, this suggests that spread of bacteria among individuals may alter the balance of bacteria in the vagina and potentially predispose to bacterial vaginosis. However, since bacterial vaginosis also occurs in celibate women, other causative factors must also play a role in its development. It is not possible to contract bacterial vaginosis from toilet seats, swimming pools, or hot tubs, or from touching contaminated objects. How to prevent. Because the cause and development of bacterial vaginosis is poorly understood, it can be difficult to take measures to prevent it from occurring. Reducing certain risk factors such as limiting the number of sex partners, avoiding the use of vaginal douches, and taking all medications as directed when being treated for bacterial vaginosis can help reduce a woman's risk of developing bacterial vaginosis. The ways to treat bacterial vaginosis. Bacterial vaginosis is treated with antibiotics. There are no effective over-the-counter treatments or natural or home remedies that have been proven to resolve the condition. Although sometimes it may resolve on its own without treatment, recurrence of bacterial vaginosis is possible even after successful treatment. More than half of those treated experience recurrent symptoms within 12 months. It is unclear why so many recurrent infections develop. With recurrent symptoms, a second course of antibiotics is generally prescribed. Some of the symptoms. Many women with bacterial vaginosis usually have no symptoms. When symptoms do occur, The most common include vaginal discharge that is usually thin and grayish white. Vaginal odor, foul-smelling or unpleasant fishy odor. The vaginal discharge and odor are often more noticeable after sexual intercourse. The amount of vaginal discharge that is considered normal varies from woman to woman. Therefore, any degree of vaginal discharge that is abnormal for a particular woman should be evaluated. Statistics. Bacterial vaginosis is a common condition in women between the ages of 15 and 44. Approximately 29% of women in the U.S. are affected. 25% of pregnant women, 60% of women with STDs, and 84% of women report having no symptoms. Here are some pictures of bacterial vaginosis. As you can see in this picture, which is a zoomed in portion of this right here, there's bacteria within the inner walls of the vagina. In this picture you can see an example of what the grayish white discharge is that comes out of the vagina. Thank you for watching my public service announcement on bacterial vaginal discharge.